Did you know falls are the leading cause of injury in elderly and sometimes death can happen? So, as a nurse and a caregiver, we need to ask ourselves how many falls can be prevented. Today, I'm gonna discuss how nurses can prevent falls in elderly using nursing assessment, intervention, and education. Hi, my name is Mahizabin Lupin, and I am an RN and worked at a long-term rehab facility for over a year. I have gained insight in the best practices in fall prevention. We all have elderly parents or a family member. As a nurse and a caregiver, encounter at least once that elderly patients are high risk of fall, whether at home, at a facility, long-term care, or at a hospital. Our actions can save life and prevent injuries. Today, I'm going to discuss the causes of fall, the nursing assessment, intervention, and most importantly, educating the patient and family. I have learned some new ways to prevent from a study by Mayura and Kanoa conducted in 2025. The study also talked about some of the causes, such as the main causes of fall prevention is extrinsic and intrinsic factor. The intrinsic factors are muscle weakness, balance issues, could be from Parkinson's or stroke. The extrinsic factors are medication use like diuretics, sedatives, as well as poor lighting and environmental hazard. So the nurses need to acknowledge these factors during the assessment. Then the nurse's role in fall prevention would be the assessment they do, such as Moore's fall risk, Moore's fall scale, and the barge balance scale. At my work, I use Moore's fall scale. This is a questionnaire, simple questionnaire, whether the patient had a history of fall, if they're using any ambulatory aid, a cane, a walker, how is their mental status. So this gives us an idea if this is helping them and what are the next step we need to take. So some of the intervention are that I learned from the study, again from Mayura and Kanoa, that using a wearable device that can give an alarm and give us a warning that this person is trying to get up. Non-slip footwears are very important. At my work, I use a toileting schedule because as they get older, elderly people tend to forget that they need to call for help or they need to use assisted device to go to the bathroom. So making a schedule to take them every couple of hours kind of helps them from getting up and prevents the fall, and as well as rounding every hour to see if they're trying to get up or trying to wander off. Next, another thing that I learned from the study by Miura and Kanoa is called collaborating with the PT, OT, and the pharmacist. So the PT and OT can teach the physical activity, which can help with the strength and maintain a balance. And if some reason the medications are not working well, if we have any alternative that can save them from feeling dizzy or sleepy, so consulting with a pharmacist would really work. So the nurses need to document accurately and timing the intervention they have applied to prevent falls. And lastly, patient education and educating the family is very much important, such as on safe mobility techniques and as well as using the assistive device correctly, educating them about the importance of physical activity, evaluating the safety at home or any type of safety they can maintain, and also teaching the patient that they need to report if they're feeling a dizziness, unsteady gait, and suddenly a side effect from a medication. As nurses, our role in fall prevention goes beyond checking boxes and assessment tools. Through understanding fall risk, assessments, intervention, and educating the patient and families, falls can be prevented and protect the quality of life in elderly patient. Each fall we prevent is more than avoiding a bruise or broken bone. It is protecting someone's independence, dignity, and equality of life. Let's commit to noticing the small risk factors that causes fall and save someone's lives before it's taken away. Because as a nurse, we are not only caregivers, but also the protectors of the people we care for. Thank you.